Okay, this is Arnie. I'm Dr. Wagner, and this is his first time in here. His wife comes here, and he feels good his entire life, never been in the hospital, but on October of last year, he had to have a hernia operation. And his only symptom he thinks he has is that his right leg in playing tennis and in his activities doesn't seem to respond the same way as it used to respond. So what we're going to do is we're going to check this and see if there is an imbalance left over from the surgery, which could last forever and cause other complications, or is it something I can just fix? So what we're going to do is we're going to give him a quick exam and see what we find. In general, I want to see how strong he is, or can he respond. I am pressing down on his muscles. He's absolutely fine. We're going to test this left leg and see what happens. Now straighten your leg out. Hold it up tight. Hold it. Very strong. There's no way I can move that leg. And we're going to say very strong. If you notice, he can't hold this leg up. One finger is taking it down. So he has an inhibition of nerve supply to this leg due to something. Of course, was never there until the surgery. So we have to figure out if something has not come around. Usually in cases like this, it never does come around unless somebody who knows what they're doing can fix this. So what we're going to do is we're going to test to see whether or not he has a torqued pelvis. So I want you to touch here and here. Hold this up. That has no effect whatsoever. We're going to test here and here. Touch here. Hold this up. Hold it. That's all my weight. So what we have discovered is secondary to the trauma of the surgery, no different than falling down. It is a strong trauma. Certain muscles were inhibited and they haven't turned back on. So it's no different than a house. Circuit breaker goes out. The kitchen's not running. Somebody has to go to the back of the house and turn on the circuit breaker for that kitchen. Same thing happens in the human body. In normal therapy, orthopedist, he would say everything's fine. Neurologist would say everything's fine. Average chiropractor would probably study the spine, give some adjustments. But this is not that kind of problem. What we have to do is we have to reset the pelvis so it has equal distribution of energy on the right and the left. So deep breathe. And I am doing a special torque of his pelvis. And we don't know if this is going to work or not, but we're going to find out. Breathe in. 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 Good. So then we're going to give a test and see what happened here. Hold the leg up. Yeah, that's all my weight. I can't push any harder than that. So now what we're going to do is we're going to see in different angles if that has corrected. So you're going to hold the leg over here. Relax, straighten your knee. I'm going to pull it. Good. Relax, relax, relax. Push your leg out to the side. Very good. Pull your leg downward. Push down. Good. Push down. Good. Now we're going to take this knee and I'm going to pull. Good. He's passing every test. Hold it. Good. Now he's going to hold this foot this way and I'm going to pull this way. Absolutely no strength. He can't even try to do it. Whereas this side of the leg, hold it, as strong as a rock. Interesting, this muscle is called the piriformis. It's in his butt. If this wasn't corrected, eventually he'd get sciatica, not from the spine, but from the buttocks, a pinched sciatic nerve. So now we have to figure out what is causing that. So what you're going to do is you're going to touch the hernia area. You're going to touch this point here. And I'm going to pull your leg. Hold it. That works because if you contact an area that is the cause, there's an incredible response, a biofeedback biofeedback response in the body, and then that will reconnect the circuits, no different than turning on the switch. Okay, deep breathe. And out. In. And we're going to see whether or not this works. There's always a test before, a test afterwards. Hold it tight. It's as strong as I can do. So we have reset this. So a surgery, and people don't understand that, they think that they recover. I'm reprogramming a laser. They think that they recover, but in effect, they never recover. The surgery itself, of course, does, but the neurocircuitry doesn't recover, and the person needs to then compensates and eventually adapts to the weakness, and then that leads to other problems, like a shoulder problem, a hip problem, a calf problem. And they come in years later, and I trace it to a surgery. That when I treat the surgery, and all the other problems go away. So whenever there's a surgery, there's a scar. And whenever there's a scar, there's a major interruption of electromagnetic impulses. So what we're going to do is we're going to use a cold laser on scar tissue. Our lasers we can program in any condition, and we're going to treat this right over the scar area. The light will go through the clothes. Hold this up. Good. Now, put your knees up together. Squeeze your knees together. Okay. Relax, relax. Hold this leg up. So what this means is he has one other problem. And that is his adductors. Hold them together. Good. Relax. Hold it. Relax. He has no strength when his pelvis is slightly to the left. Hold it. He can't hold his leg together. But here he can. So we have to figure out what is causing an adductor problem. Hold this knee in, and I'm going to pull it out. You can't do that at all. Hold it in. I can't move. That's the way it's supposed to be. So the question is what is causing this? How much like you hold right here? Touch that point. Hold it right here. Okay, that point has nothing to do with it. I'd like you to hold right here. Nothing to do with it. Hold right here and here. Keep this one down. Hold this in. That's it. So he has, because of the trauma of the surgery, he has a double pelvic torque. So what you're going to do is every time you breathe in, you're just going to move your knee this way and then back. Move your knee this way and back. Okay, deep breathe. And out. In. 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 And out. Now I'm pushing on his pelvis rather hard, but no pain. And it's just to torque the pelvis back into position. Hold it tight. I cannot move that knee. You're going to put your knees together. Squeeze together hard. Relax. Lift the leg up. Straighten your knee. Straighten your knee. Hold it tight. Good. Relax. Hold this up straight. Hold it. Good. Well, we found 3 major issues of post-traumatic stress in the pelvis due to this thing. Eventually, it would have really inhibited, you would have chronic musculoskeletal problems. But those are fixed. They don't have to be fixed again. Next time, I will check you in another position. I will even give you more advanced tests. If you pass them all, you're all set. His other problem is the doctor found at the time that he has high blood pressure. We'll take care of that on the next visit. And we'll find if there's a natural remedy or if there's a cause of that or a certain food. I think we did really good, Arnie.
Thank you.
Shake. Come on up.